right. So my job is to talk a little bit about some of the numbers, some of the business models that we see as having success within the digital health community, and we'll start right in with a little bit of additional information on some of what was just talked about by Brian and Wayne in terms of digital health funding. These are numbers also from Rock Health, so this is some of the breakout of where the investors are placing their bets. First, we have the 2015 numbers, then I got Q1 2016. And you can see, if you look at these first three categories for 2015, a really heavy focus on the consumer side. And this is something, if you go back to, say, 2013 funding, you'll see things like data and analytics and population health management, more the traditional EHR and workflow. The traditional enterprise software solutions were getting most of the money. If you look at 2015, 2 years later, very much consumer-facing type tools or consumer-facing type solutions, whether they're wearables, which are sometimes direct to consumer, obviously, but there are also medical wearables. We'll talk about that in a minute. Healthcare consumer engagement tools, personal health tools and tracking. So some of these are still sold into the provider or maybe even the payer world as the buyer of the solution, but they're customer or consumer-facing solutions in the end. And then, the next three were the more traditional, enterprise-based type healthcare solutions. So a lot of the money in 2015 went into the consumer side. If you look at the first quarter of 2016, so this is through March, and again, this is Rock Health data. Again, 1 in 4 are still part of those consumer-type facing tools. So again, a lot of the money going into the consumer side. 2 and 3, categories 2 and 3, and you can see 2, 3, 4, all about the same amount of money. We're getting into now, again, some of the more traditional enterprise software-based solutions again. So a little bit more of a mixed bag here. It's only 1 quarter. But if you look at as well the numbers, remember in the previous slide, wearables were around $450 million last year in total, already $202 million in the first quarter. So the numbers continue to rise. Again, very heavy consumer focus. And when you get into 5 and 6, again, you see healthcare consumer engagement again. So a lot of focus from the investor community on how can we either directly interface with consumers around their health or enable providers and payers as the buyer of the solution to interface with their members or their patients, consumers around their health. So very heavy focus on consumer side. That's one of the trends that we've seen over the last couple of years that I think is quite interesting. If you dig deeper into some of the wearables numbers, and I know there are a lot of wearables companies, so we decided to talk a little bit more on this subject here. You can see that, of course, we all are familiar with the consumer wearable side, and we tend to think of wearables as consumer wearables. But we saw yesterday on stage some of the medical grade wearable type products that are out there, and that's a pretty significant market as well. It's actually growing faster than the consumer-facing, the wellness, fitness, sports side. If you look at the bottom, first bullet here, regulated clinical grade wearables are expected to grow at almost 33%. So, very rapid growth rate over the next several years in the medical grade wearables side and becoming more complex. We saw a little bit again yesterday of some of the smart wearables, wearables tied to platforms and analytics, and delivering that information not just to the providers, certainly that's part of many of these solutions, but also how to deliver some of that analytics to the consumer, to the patient or individual themselves. And so that's driving a lot of growth in this market, and we're looking at that top category and saying, hey, there's going to be a lot of commoditization in that top group. It's going to be tougher to be in the business of consumer-grade wearables probably in the near term. The medical-grade wearables, while it is a regulated market, it has the FDA as part of it, it is a difficult market to break into, but the opportunities there in terms of multifunction, in terms of smart technologies, in terms of analytics and platforms seem to be pretty strong here in the coming years, and probably a better bet to say you can make a place and make money than that top category. A lot of those medical grade wearables are going towards the things that are cost drivers in the systems, of course. And that is chronic disease. So this is the categories of chronic diseases and where those wearables fit in. You can see sort of the market opportunity side here. And what we see is that top right, And the measurements here, level of attractiveness, meaning market opportunity, and then competition. Of course, people are competing very heavily in those large opportunity areas, but there's a lot going on in terms of chronic disease care here, and a lot of opportunity in terms of systems, health systems, individuals, and payers looking to invest in those spaces. So in terms of wearables, you can see that the chronic disease conditions that we're familiar with and that we talk a lot about in terms of drivers of costs in the system, causes of death, et cetera, are an important factor when we look at the medical grade wearables market and where it's headed. These are some of the opportunities, and at the bottom, these are global numbers. So in terms of cost savings, I believe these are global numbers. In terms of cost savings for systems, actually those look like US numbers come as I look at them in more detail here. Fitness and wellness monitoring, what we're very familiar with in the traditional wearable space, is still an important opportunity, and it's still where we see a lot of the early systems and investment going into. From, if you look at, for example, what United Healthcare announced in the spring around giving individual members a Trio that they would wear, count steps, and had 3 different levels of which they could earn back money from the health system or from their insurance plan, up to $1,500 a year per person for 2 people in a family. So, just a simple step counter that was measuring if you took 10,000 steps a day, you got $1 off of your insurance, or $1 paid back to you into a health HSA plan. If you took, I think it was 300 steps in 5 minutes, 6 times a day, you got $1.50, and then there was another $1.50 tied to, I believe it was 3,000 steps in 10 minutes, so that you were having a relatively high level of activity. So those 3 gradations created as much as $4.50 a day back to an individual. Okay, simple fitness and tracking, but they determined that, hey, this will help to reduce healthcare costs among our members, and therefore we're willing to make these investments. In the low acuity monitoring side, medication adherence is an example. You can see the cost savings there. Those are some different wearables that we're pretty, again, familiar with. And as we go to the right, we see some categories that there's probably less activity today, but great opportunity in the future in terms of more high acuity monitoring and in terms of chronic disease care, which we're seeing through the reimbursement channels starting to get paid. But in the end, what's going to drive chronic disease care management is not reimbursement. It is this shift towards value-based care and the willingness of payers and providers to invest to save money, not to get reimbursed. Of course, commoditization, price challenges impact the wearables market and will continue to do so going forward. If you go to CES and you look at the digital health exhibits that are there in the last couple of years, you've seen all kinds of companies come into the space. Under Armour was a big investor in MyFitnessPal. They're a company that's now positioning themselves as a digital health company. You have companies coming from overseas. I was just in Brazil at a big hospital event. There was an Argentinian company that had an Intel-invested wearable that had a very high level of clinical grade ability to do heart monitoring and other factors as well, can put into, again, a platform and analytics that can be provided to an individual or to a payer provider. So, competition around the world is really going to drive pricing down in this space. But beyond that, there are some other issues. One of the factors is that, these are products that in the end are worn by consumers. So they might be sold to a payer and provider if you're trying to put together a chronic disease management solution. But the user is still an individual, and a complex solution that doesn't provide a lot of benefits and doesn't look good is still going to be a challenge in being successful in the business. So you're seeing a lot more variation in terms of look, feel. You're seeing more variation in terms of the combination of sensors that are on different wearables. And you're seeing the need to sort of build that ecosystem of partners, whether it's a partner on the platform side, whether it's a partner on the analytics side. Those are some of the success factors that we see driving the wearables market over the next few years. Additionally, unreliable and inaccurate data. There have been tests that have been done in terms of heart rate with different types of wearables, and the variation in terms of what you get back as an accurate measurement is quite wide. So when you're looking at a tool that's going to be used to try to help guide your health and make decisions or provide that information back to a provider who's going to use that in terms of trying to advise you about health or create alerts, the accuracy of the wearable in terms of what the reading is that's coming off of it is really important. That's been overlooked to a large degree. It's starting to get more attention as providers and payers are looking at how they can utilize this information in clinical analysis. And then the last one, as you're getting into, again, a more complex world of it's not just a consumer device, it's also a payer-provider system solution. Now you've got this complexity of, okay, I can provide value to my customer, a healthcare provider, but am I providing value to the individual? Because if the individual's getting nothing out of it, at what point do they stop wearing it? Do they stop utilizing the system themselves? And if they obviously don't wear the device, then you don't have any data coming off of it at all. So that complexity of how do you create value for different stakeholders in the system has been a challenge when we look at consumer-facing and provider-paid solutions in the past, and continues to be a challenge that companies have to face and address. All right, if we look at just quickly some business models, one of the areas that's interesting that has become a little more quiet over the last few months, but I think has gotten a lot of attention from the healthcare provider world is the retail health side. Walmart, as we all know, announced that they would offer retail health services, $40 charge out of pocket, pretty cheap, and that has gotten a lot of attention over the last year. But maybe more important is what Walmart's doing in terms of trying to put together a package of chronic disease care. So this is what Walmart has proposed in terms of diabetes, in saying they will combine these different elements into a package for a consumer or a payer provider, and they are developing partnerships in both the payer and provider side for relatively low cost, $600 a year, $50 a month. A diabetic can get primary care, 12 coaching sessions, generic drugs, a glucometer, healthy living and diet recommendations, and referrals to specialists that are relevant to their own care. So all of that at a relatively low price out of pocket, okay, or a very low price, and you add the convenience of retail health into it, and then as they're starting to build this network of providers where they're offering these solutions, now you've got a real change that retail health can start to bring. It's not just, hey, my kid's sick, it's easier to go to Walmart than to try to get an appointment on my doc. It's somebody is going to address my chronic condition and provide me with a package that's going to take care of everything at a price that is a Walmart price, right, that I can afford to pay even if it were to be out of pocket. All right? So this is a real shift that we believe will have a big impact from the retail health side. Some business model challenges. The biggest one that we all have is who's going to pay, right? The cost-benefit misalignment that we've had in the system, because most of these solutions have been sold to providers or marketed to providers. Hey, healthcare provider, buy this remote monitoring solution. Here's how you can help manage your chronic disease patients. But providers generally aren't the ones who benefit, right? In the fee-for-service world, keeping people out of the hospital, having people not come in to see them has not been a revenue driver. They have obviously an interest in keeping their patients healthy, but they don't have a revenue benefit from it. The revenue benefits or the health benefits go to the individual, they go to the payer, but we've been asking the provider to foot the bill. So we've had a misalignment in the fee-for-service world that has kept remote monitoring to be a relatively low-growth small market over many, many years. If we want to really change that paradigm, we need to see people like payers, and we saw United Health on stage here. They've been one of the leaders in sort of stepping up to the plate and saying, hey, we're going to be footing the bill and trying to provide these solutions directly to our members. Individuals, we've had a challenge of our own mentality towards our health, sort of a break-fix mentality, a cap of about $30 or $50 a month we're willing to pay to maintain our own health. We expect that to be at no cost to us. And then a lot of people have been addressing the employers as the target market. That could change quite rapidly if we move towards a private exchange market and employers are a little bit more withdrawn from the costs of care or have a fixed cost through a stipend, their interest as well might change. So this is still a challenge, and how we address it is going to be interesting. One other item is the supply and demand misalignment that we've seen in terms of pricing. If you go talk to the big healthcare systems, they will tell you that if they're going to take 20% of their diabetics and put them on a mobile health solution, or 20% of their cardiovascular patients and put them on a mobile health solution, they need the price point to be about $10 a month, right? That's way, way below what is the current offering out in the system. So how do we move down that demand curve? If we're really going to get to a market where we have mass deployments, we're going to have to bring the pricing way down. And there's a misalignment between what we see on the offering side, the supply side, and what we see on the demand side. So that supply curve has got to shift downward and to the right. And what are the factors that are going to drive that are either technology or it's going to be something on the competition or cost side that helps to bring that down. We have not really faced the issue of data ownership and had to really face that to date, but that's probably going to keep coming up. And it's going to come up more as people start to realize the value of their own data and potentially want to capture some of that value, or there may be companies that try to aggregate individuals and capture some of that value. Data ownership is an issue that we haven't really had to face, but we may have to going forward. One example is in terms of the regulatory side. There are regulatory proposals that say for secondary use of data, they have to get your permission every time they want to use it for different types of research, for example. So that would say that every research use of your genomic data, for example, would require a signature for you, a new signature each time. Could really put a crimp in the research use and secondary use of data if that were to move forward. There are definitely data ownership issues that we have to address. Opportunities. A lot of payers are looking at point-of-care testing in the home and trying to say, how do we move point-of-care testing, not just to the edge in terms of the physician's office, but to the patient, so I can get direct information on my chronic disease patients from their home. And we've seen a lot of investments go into that sector in terms of the biotech side or in terms of the diagnostic side, trying to develop solutions that involve very small amounts of blood and ability to read that information and transmit it from a home environment back to a provider or even a payer. And then last on our side, we believe that health IT as a service is going to be a huge driver, not just of digital health here in the United States, but maybe more importantly in a lot of the developing world. You can't really expect that, we've seen a lot of challenges on the enterprise software model that we've adopted here in the US, and the challenges of interoperability that have come from that, the challenges of moving towards EHR adoption. We overcame that through a huge investment from the government, to be frank. But if we look outside the US and we say, how do we really move towards digital health? Health IT as a service, analytics as a service, all of these solutions not being housed and sold to an enterprise customer, which might be only a few hospitals in some developing countries that could afford that. But even in the US, trying to reach many, many rural hospitals, you're not going to be putting IBM Watson inside of their data center, right? You're going to have it more as a service. IBM is aware of that, and they're offering it that way. I'm just going to skip over this one quickly. When we look at everything that goes on in the hospital, and this is just a few examples of what are some of the things that hospitals are required to do, which of these are really core competencies? You could argue that diagnosis, surgery, and treatment are it. And after that, all the rest of these things are certainly opportunities to create solutions or outsourcing or BPO type opportunities that could involve digital health tools. So there's a huge amount of opportunities around hospitals and healthcare systems, and what are really their core competencies versus what they have to do to manage their business. In most other businesses, we would look at this and say, let's get rid of a lot of these other activities, and we're starting to see that happen in hospitals, of course, in terms of many of these things. Supply chain management, contract management is starting to be outsourced, but call centers, but IT application management, no way currently. In the future, would we see that? Could we see that? We certainly believe there are opportunities there. And then in the last here, a couple of seconds, I wanted to focus just on genomics. Brian mentioned that the digital health tools that are used to help post-sequencing understand genomics and provide clinical decision support tools to providers are certainly part of digital health. We believe that as well. Digital health opportunities exist. We're seeing IBM Watson and what they're doing try to tackle that in terms of being able to provide a tool that will post diagnosis based on gene variants, help to identify what are the best care pathways that an individual could follow, what are the most likely drugs that will lead them to success. Intermountain Healthcare, which you probably all know is a provider, a healthcare provider in Utah, has offered a sort of genomics as a service model to other healthcare providers. Any healthcare provider in the US can send a sample, DNA sample from their patient, and Intermountain, which has their own sequencer from Illumina, will do the wet lab work. They'll sequence the genome. They will do the diagnostics. They'll put it through their molecular tumor board, and they'll help to identify the issues. And then they will even identify through their own bioinformatics team the best drug choice in order to address this condition. And they'll even procure the drug and have it delivered to your patient. So they're sort of doing everything for other service or other healthcare providers, trying to help get them over the hump in terms of being able to access a modern genomics-based solution, even though not every provider will have all these tools in-house. Intermountain has them, and they're saying we'll make it available to other providers. CancerLink and SAP just announced last year in September a program that's going to leverage the HANA platform and try to, as well, provide for oncologists across ASCO a tool that could be accessed in order to do a similar sort of transactional-based diagnosis for any oncologist patients. Again, getting away from that enterprise in your office-based solution towards more of a transactional as-a-service type solution. Philips and GE are both working on building Health Cloud or other solutions that create a platform to do similar things in the future. And I'll just pop these other three up here. By 2020, we expect consumers will demand that genomics be part of the standard of care, and we'll see people actually start paying for that already. Every payer in the US is also looking at clinical decision support tools like this that they're going to use to try to determine already, and they're already investing in these tools, what is the best and cheapest care pathway for their members, and that's the only thing that they'll reimburse potentially. So payers are playing in this space, and then as we mentioned, that transactional way to spread these tools across all oncologists, no matter location, no matter whether they have access to them in their enterprise or not, is a way that gets us over this tipping point and to the next step in terms of digital health. Okay, I think I went over and I apologize, but thank you very much.